Hello, everyone. This is Kathy Barnette, and you are listening to the Kathy Barnette podcast. I am in studio again with part 2 of my conversation with Dr. Lauren Schwartz. Doctor, thank you so much for agreeing to come back and doing another hour with me.
Absolutely. I'm thrilled to be here. I really appreciate being able to talk about this. It's just so important.
I think it is. I think it is one of the most important conversations we can have. There's a lot of things I talk about. I talk about China. I talk about the war in Ukraine. I talk about what's going on in the Middle East. I talk about inflation. I talk about the open border. I talk about a lot of stuff. Trying to pick an issue in our country right now to talk about and to be angry over is like trying to drink water from a fire hydrant. So much has gone wrong, but this topic of transgenderism, and specifically among our children, is something that, it's a thread I must keep pulling. It's like I have to keep pulling on this thread. So I am so very grateful anytime I have someone of your caliber, a psychiatrist, very well trained. You walked us through your training in the first episode, so you guys can go back and listen to that. But it's a rare occasion when the rest of us can sit down and ask these questions and just listen and learn. I said in the last podcast, knowledge makes a man unfit to be a slave. If you don't want to be a slave to your environment or to other people's agenda, start with knowledge. Start by reading, talking to people, informing, asking questions. And so, Doctor, thank you so much. One of the things I want to pick up from our last conversation when we were talking about this new trans book that has, or Gender-Affirming Psychiatric Care. But there was something you said in the first hour, and you were talking about you don't want to minimize the feelings that these young children are presenting when they go in and they sit with a psychiatrist like yourself and they begin to express these feelings. And you said you don't want to minimize it. These feelings are real feelings. And I agree. Very early on, I decided, many years ago, more than 10 years ago, when I began to see these conversations pop up, and I began to see a nation that was beginning to make permanent decisions based on feelings alone. And as I began to listen to the people who were displaying whatever kind of dysphoria, it presented to me that these were real feelings for the overwhelming majority of the people who were talking. Yes, you have some charlatans, but you have charlatans no matter where you go in life. But I learned then to accept, and for the most part, that these are real feelings that they are feeling. And yet, we have every reason to push against the consequences of everyone going along with those feelings. But when you mention it about their feelings being real feelings, I thought to myself, they may be real feelings, but I question whether these feelings are organic in the culture in which we live in, or if they're inorganic, being forced upon the children. It's a daily pressing. They hear it and on TikTok, they see it on Instagram. They're hearing it in almost every subject at school. They're modifying how they talk about things. They're coming up with whole vocabularies, new vocabulary words that they have to learn. Everyone has to be so hypersensitive. So although the feelings may be real feelings, I don't believe that the feelings are always organic. That is something that, apart from anyone else pushing it upon the children, they would have those feelings. Well, what do you say to that?
Well, I think that's a really important distinction. You mentioned schools, for example, and I talk a lot with schools and with school boards. And I think one of the important pieces of this, that it's an active participation in a child's development and experience when you affirm. Validate and affirm are not the same thing. So affirmation and celebrating something, and when a child comes to a teacher and says, "Oh, well, here's my new name and pronouns. And they say, oh, this is so wonderful. And we're going to start using it. The second that teacher takes over, or parent, or, adult in that child's life who plays a huge role in their lives, and they want to make their teachers happy. They love to see their parents excited about something. That becomes solidifying. That becomes more fixed right in that moment, because now it's no longer supportive neutrality where it's, oh, that's interesting, and here we're learning together in an educational environment. It's now having a psychological impact on that child. And it's there, I will say, for some, of course, a teacher likes to see that, oh, that child's excited about it in the moment. But what happens if the child changes their mind? What happens if the child decides, maybe this isn't the path I want to be on, or maybe I want to do it a little differently? Children change their minds just about, I don't know what they're going to wear each day. And I know this is different than that, but to think that an 8-year-old or a 12-year-old or a 15-year-old is absolutely certain about something, and that's going to be exactly how they're going to exist their entire life, doesn't make a lot of sense. But I always try to help people understand, you're actively participating in something when you affirm. And so does that make sense? There's a difference between that validation and being a supportive adult in someone's life, and then affirming a belief and not departing from it.
I like that. Validating is not the same as affirming.
Mm-hmm.
Affirming is taking it a step further, where now you're actively participating in the delusion.
Right. And I think also think about the other kids in the classroom. Everybody's developing a little bit differently. Some kids may not feel so sure as their friends about how they feel about themselves and their identity. And now the teacher's saying, well, there's all these options. You get to choose. And they're thinking, but I don't feel that way. Maybe something's wrong with me. So now you're starting to create more angst and more psychological distress in a whole classroom. And especially with younger kids, they want to be compassionate. So if they say, well, this supports your friend by proclaiming your pronouns or proclaiming your identity, why do they need to proclaim? Why can't they be children and play and explore? And when we know it's developmentally appropriate to have, imaginative play that changes day to day.
But now when a child presents themselves as a cat, and now we're putting litter boxes in elementary bathrooms, right? And now when the kid meows and the teacher is being instructed to affirm that by playing along as if meowing is, I think we've extended beyond the role of these institutions.
Yeah, I do think that's a very good point. Also, is that you take teachers who are wonderful at what they do, and I firmly believe that majority of teachers are wanting the best for those kiddos. But if they're told this is the right thing to do, they're now taking a psychological intervention. Social affirmation is a psychological intervention, and they're applying it in an inappropriate setting that's not neutral. It's in a group setting with friends, with peers. We know kids don't necessarily behave and act the same way around their friends and a group of friends. And then they're doing it with every child. And so you all of a sudden, again, conflate a psychological intervention with their educational experience at the, I think, detriment of, you lose an educational experience, or you lose just your natural ability to grow and be flexible about your identity and other people's identities. And then additionally, when you have a conversation about gender identity, fluidity with children of this age, very young kids, well, now that teacher's going to go and be the kid's math teacher next. So you take this psychological intervention, again, happening in a group setting inappropriately. And now it's also someone who's in charge of your grades, or, you're going to color something for them and you want them to be pleased with it. So you're going to do what they ask you to do. And that's what is very confusing about all of this. And
is it like a dopamine hit for people? For these kids?
To make an adult happy?
Yes.
And whether or not it's dopamine, it may be a series of neurotransmitters, but yes, pleasing an adult in their life in terms of, and I mean that in an appropriate way. Here's I want you to, you're going to celebrate I spelled the word right. You celebrated that I got the grammar correct. You celebrate, oh, this teacher also is saying they really like that I have this new identity and there's going to be a parade and there's going to be an announcement and all these things. Well, children, of course, they're going to lean into that. That's not a neutral, or it's not I think it becomes less of a choice for them. They get locked into this because they're trusting those adults. Those adults are affirming, meaning they're celebrating and proclaiming things about this child. And then where's the off ramp if they need one?
I think this is such a wonderful segue into playing this video where it talks about where you're talking about children wanting to please and wanting to do what they believe is going to, make someone smile or make them, get an A, or now people look at them like they're special and they're unique and they're a part of this protective little class of people where other kids, especially, if you're in elementary school and middle school, you're being picked on
right.
All the time. But now all of a sudden you're in a protected little class. And why wouldn't children be at risk of saying something and presenting themselves a particular way when we have adults we see all the time who are presenting themselves in not a very authentic way, but they're doing it because, they don't want to be canceled. Adults don't want to be canceled. Adults don't want to be labeled. You can lose your career, especially if you're in the world of Hollywood. So play this. And I want in that context, I want you to, and as a psychiatrist, I know you're not sitting down with this young lady or with Bill Maher, but kind of walk us through some psychoanalysis, some things that just pop out to you, because it was a lot of stuff that popped out to me when I saw it. Let me just see if I'm somewhere in the ballpark here. Play the video, please.
There's a lot of trends, I always see that in the paper about somebody who has switched their sex, which if that's what makes you,
yes.
Is that what blows your dress
Bad
up?
bitches all the way.
Who?
Yes. Bad bitches.
Fat bitches? Why
bad bitches.
Oh, bad bitches.
Bad bitches. Be who you are. Yes, claps.
Right.
Claps. Makes me happy.
I think there's some money to be made in some sort of exchange with everyone switching where, if you need a penis, take a penis. If you have a penis, give a penis. If people are becoming like men to women, they're going to cut off their penis. And then there are women transitioning who are going to need a penis. I feel like if there was some exchange, maybe Bitcoin could be involved. And you could, no?
I just don't like joking about.
Oh, Bella.
I know that you
Bella.
like to, but I
this
I
is
don't
where
think
the
it's
anxiety.
funny.
Oh, for
I don't
fuck's
think
sake!
it's
What
funny.
a shame. That is where
I'm
you're.
sorry.
That is. You don't have to be sorry, but I'm not sorry
think it's
either.
funny.
And that is where your anxiety comes from. There is nothing wrong with joking. Nothing wrong about that. It's not everybody is that sensitive. Not everybody needs to be that sensitive. Even the people who are doing that, I don't think would need to be offended by that. Everybody is so easily offended. You kids, you wake up offended. You should get off Twitter, get off social media, and maybe you wouldn't have this anxiety. Because I don't know if you're really offended or you're just worried that you're going to look offended.
No, I'm 100% offended. When I think about, someone's trauma and the videos that I have seen that are so fucking bad.
Cue the music.
But
when people have to worry about walking on the street, just being themselves, that's fucking anxiety. That's why I don't like to joke about it, because, someone hears it and on a public platform is so bad, because you're kind of low-key spreading this oh, ha, 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 ha. And it's
okay, doctor. Break that down for us. What were we just watching there in this young girl?
Well, and I will certainly say, I don't know this person. I certainly wouldn't want to comment on their mental health or well-being or anything diagnostically. I think what it does demonstrate, though, is something that we were talking about earlier. And especially for kids, again, that it's solidifying, it's concretizing, it's that this is the untouchable thing. you can't tell me this is any different. And I don't know that that was exactly what this person was saying, but I also see this when there's a victimhood or almost a victimization that kids, and I think it's this is where TikTok and social media and all these things really come into play. They wear it as their identity. It's the only thing that's important about them. And I think that's really teaching, again, kids, adolescents, young adults, that if this is the only thing that's important about you, how do you ever move into growth and wellness? And so that's where, my job is to work with someone through distress. Not every sense of discomfort is a negative thing. It tells us to move out of something and grow and expand our understanding of ourselves and why we're responding to something in an anxious way, in a depressed way, why are we having those responses, as opposed to, this is my response, and if you joke about it or you tell me anything else, then I can't tolerate it. And in any other area of mental health, we want to build tolerance, not to be criticized or abused, but we do want to give children especially that sense of flexibility. And okay, if someone says something, especially, just offhanded, and okay, I don't have to like it, I don't have to agree with it, but it doesn't have to destroy my day. It doesn't define me. We want them to develop that strong sense of self.
Yeah. And instead I see, Bill Maher is no bastion of conservative principles. And yet I think over the years, his eyes are beginning to come open, and specifically around this topic of transgenderism. But here you have a young girl who starts off presenting herself like, I'm so cool, I'm so bad, I don't fit the norm, I say, provocative things and behave in, provocative kind of ways. But then you mentioned a joke, not a joke, I would say, but he says a joke, and now you hear her voice start shaking. She's about to cry. She's so emotional, because she saw videos of something. And I see a lot of our young people who are riddled with anxiety, who are riddled with mental health issues, walking around with support dogs. And I believe that is real in many cases. How do we get there? I'm not trying to blame everything on social media, but I think a huge percentage of it really does stem from developmentally inappropriate material kids come across. You can't unsee, you can't unhear things. And I think especially when they're trying to seek an explanation to why they feel the way they do, they don't feel good about themselves for 10,000 different reasons. We could talk to 10,000 kids and it would be different. However, when they go and they connect with what sounds like something that fits online, well, then they're going to see how that goes. See, maybe that does fit me. Maybe that's my problem. And that makes sense. And so then you've got an influencer who, we know what people present on social media is not 100% of who they are as a human being and their experience. So they take that and they say, oh, I connect with that. That must be me as well. And then online it's celebrated. Now you've got a whole new community that can connect with you. And unfortunately, built into that, I think a lot of times kids come across, you can't trust your parents. Your parents don't understand you, but we do. You're accepted here. And it's this chipping away at the one foundational piece of a child's life, and that's their adult child, the caregiver or parent in their life. That relationship is so foundational to their development and thriving, and we're chipping away at that. And I think these social media platforms are as well. And then they just feel like the only thing that can define me is the thing I'm suffering with. And how cruel is that? To burden a child with, okay, well, if they truly feel, well, I'm not anything without my fill in the blank, my depression, my eating disorder, my gender, any of those, if they feel they're nothing without it, how can they ever start to work through their anxiety? So I feel like that's part of it. I think it is. And that's why I find it so cruel. I ended the last segment talking about this issue of transgenderism is so much bigger than what is just being presented in front of us. And I believe it is part of the construct of creating an uncivil society for whatever the purpose may be. I remember, listening to authors or the creators of Black Lives Matter and some other people who have identified themselves as Marxists, saying we want to make ourselves ungovernable. We want to do the opposite of those things that will create a civil society. We want to recreate everything in this country. And the way you do it is by becoming ungovernable. And you just hit on it again, is that the very foundation of my identity is my family. And it moves on to God, whatever that God may be to you, something bigger than yourself. It moves beyond that to country, right? We begin to identify ourselves by by a particular culture of values that we espouse, by my own merit, by my own, my two hands, I built this, look, me, fire, I did this, right? I mean, those things define me and it tells me who I am. And even during dark moments when you can't see your way through, you send out, I heard someone say, we're like blind bats in a cave. And a way a bat figures out where they are is by these echolocation. They send out these wavelengths and it bounces up against things that reverberates back to the bat and tells him this is where you are. Right. And as humans, things get dark and we get blinded and we don't know where we are and things get murky and we lose our North Star. But there have always been these foundational pillars in life: family, God, country, merit, that even when I'm in a dark situation, I can bounce off. I can send out these vibrations and it bounces off family and it comes back and say, Kathy, you belong to someone. Or it bounces off to, off of my religious belief and it comes back and say, you were made with a purpose, a higher calling, right? Or it bounces off against country and say, you know what? I'm a part of a bigger thing here. I spent 10 years in the military and I remember having a very real conversation with myself that I could be deployed and I could lose my life. And would I be willing to give up my life for this country? Like, what does it mean to be an American? And at the age of, 17, 18, I began the process of learning, what does it mean to be an American? And what could I be putting my life up for? And am I willing to do it? And I was, because it was something bigger and greater than myself. And it defines who I am. Well, in today's culture, all of those stakes have been uprooted one by one, right? Country, no, it is systemically racist, they tell us, and we need to bow the knee whenever our flag is presented. Family, no. Your transgender group, your LGBTQAI+, that's your family. They define you, right? What was the other one? My work, my merit. No, it depends. If you're white, then you should be flogging yourself. You have privilege. You're an oppressor. If you're heterosexual, you're an oppressor. You're the oppressor group, right? So those things that once brought stability into our mind, into our soul, into our spirit and body, those things have now been uprooted and we replaced them with, like I said, diversity, inclusion, equity, and all of these other things. And I believe that is perhaps one of the reasons why our children are just, and many adults are just riddled with anxiety. I see it. People are like walking on eggshells, like any minute things are going to explode around us. Am I far off?
I really don't think so. And hearing it at home just as much as hearing it in clinic, that you can't make a mistake. you can't say something wrong. No, you have to make sure that when you're proofreading your essays, that you got to make sure you're not going to offend anyone in the classroom or your teacher or anything. That's what you're proofreading for, not grammar. So there's this constant worry, I'm going to say the wrong thing. And at the end of the day, we're human and we do make mistakes. It's part of life and developing that, okay, I make mistakes, other people make mistakes, and we can still coexist and live together and love each other and support each other. It doesn't mean that everything has to go perfectly every time in a conversation. And that means that somehow you are better or worse than I am, or you're a good person and I'm not. And with kids, I think, especially with the transgenderism in schools, it becomes something that if they don't want to be perceived as the oppressor or part of a group that they don't like or agree with, well, this maybe becomes something where it's like, okay, now I'm a part of a different group. It's an opportunity to shift out of something they're not happy with, and in their minds, okay, that's a better option. I'm not saying that's with every child that's having feelings about being transgender, but I do think that the schools somewhat create that as well. That why be this in one group when I can choose to be over here? And so I think it's taking something developmentally inappropriate and putting it, burdening children with it, far too early for them. They're in there and not allowing them then to develop a full sense of self, and that identity happens over years.
I think so. And so that gets us back to where we ended the first session, or the part one of our conversation around this new what are they calling it? The new trans textbook. It's called Gender-Affirming Psychiatric Care. You are a psychiatrist. And it is published by APA, the American Psychiatric Association, which, as you explained to us in the part one, that the APA is the overwhelming majority of the books doctors like yourself are trained from or published by the APA. This particular book, Gender-Affirming Psychiatric Care, has a very high peer review rate, which that signals to others who are reading it that this book must be the real deal, that there's been a lot of peers who have reviewed it. And so it must be science. It must be the new way of thinking. And so, which is very alarming based on everything that we've talked about in the first part one. And now even, as we open up this particular segment, because if my child presented in some way that that deviates from what we consider normal, I would consider, or I would have in the past. Today, I would strongly reconsider coming to most psychiatrists, psychologists, and talking about our problems. But in the past, but most people would strongly consider coming to someone like yourself. And now to know that future doctors are being trained with this, current doctors are being advised to adhere to this, is very disturbing. Why is it disturbing? Not just that it's gender-affirming psychiatric care, but those who were a part of the writing. Again, as I read in part one, the opening of this investigation that Epic Time put out, it reads, a new cutting-edge textbook on transgenderism written with the help of activists will be used to train psychiatrists. The next part, the textbook signals early on that it's more subjective. You want to define that for us, doctor, versus objective?
Well, that's what we were talking about before, the idea of someone's lived experience being prioritized over expertise and knowledge based on evidence-based medicine. Even in their introduction, it talks about this is an evidence-informed text. It's not evidence-based, which I know sounds like it's not that different, but
what is the difference? Tell us the difference.
There's a huge departure. This was actually the first time I'd really seen it evidence informed being presented in a textbook. Evidence-based medicine, we take classes on it all through med school and residency. You look for the highest levels of research done. You hear about, randomized, controlled, double-blind studies, these very rigorous studies. Systematic reviews are in place for a reason, because someone can follow each of the steps from step one and reproduce it. And so it's not just, hey, take our word for it. We did this one time. It's the highest levels of rigor in, the scientific method. And can it always be done? No, but you strive for it. You don't throw it out. And instead, this is where we're looking at, lived experience apart from any type of actual knowledge and research. In the book, there are sections that truly target some of very well established practices that we know we've built on over decades, from child developmental theories and treatments, and all of a sudden those just get tossed aside and say, well, this is what we're saying is better.
For example, would one of those time-tested processes that you as a doctor would take, would one of them be what you talked about in part one, which was, if someone presents as suicidal, the first thing you would begin to do is try to stabilize the situation versus a rush towards transitioning them?
Mm-hmm. Oh, absolutely. Absolutely. And I think even backing it up further, suicidal or not, we always do a comprehensive evaluation of any patient. And then you work in just that idea of every part of that human being belongs in the treatment. It's not just one particular thing that they bring to you. To me, that's almost, I've heard the term vending machine medicine. I don't know if you've heard that before, where someone just comes in and says, okay, well, I'm going to pick my treatment. I'm going to get it. And it's not safe. And so I feel like there's so much being tossed aside to rush forward, to push forward, to, it just is amazing that in this book, there's a lot of neglect of other diagnoses, whether someone's autistic or has ADHD or has depression or anxiety or all of those, you affirm first. And it's a very, I've never really seen anything like this in medicine.
And this book, they affirm first.
Mm-hmm.
Yeah. It's very dangerous. But what's also interesting about this book, there are 26 chapters in this book by 56 authors. I don't think I've ever seen that before. I've read some pretty technical books, but this particular book has 26 chapters, 56 authors, 50 of whom are in the transgender community. You and I talked earlier in part one about this being more of a movement in medicine. And when I hear the word movement, I'm thinking activist, a movement versus science driven.
Well, and one way to look at that, when you think about an adult, and there's several of the studies that are quoted in the book that you see a lot in gender affirming care, books and papers. You hear that, well, as an adult, they did all these interviews and they took surveys, and adults who have transitioned look back and say, I would have been better off, happier, more stable if I had been affirmed or if I had had access to medicalization earlier on. And just like we talked about in the first hour, children aren't just little adults, right? So to be able to take someone's perception of what would have been better for them as a child and then take that to mean, well, it's fact that every child should be affirmed no matter what based on that doesn't make a lot of sense, especially because we know as soon as someone starts on puberty blockers, it's about 95, 98% go on to cross-sex hormones. And then of those, they're going to be dependent on hormones for life. And if they have surgeries, the cross-sex or the affirmative surgeries, they're going to have issues there as well, where they're going to be dependent on exogenous hormones or taking hormones into their body that their body can no longer produce. There's just, it's medicalizing in a very fast way before they have a chance to know, well, do I ever want the choice to have children or breastfeed my own children or have a relationship? It just, yeah.
I mean, again, it just baffles the mind of why adults would make a permanent decision for these children. I mean, because in part one of our time together, you talked about in this book, they kind of present hormone blockers as a flip of a switch.
Mm-hmm.
You turn it off, but then when you want to turn it back on, just flip the switch again, right? And I was talking to, again, Chloe Cole is a good friend of mine now, and she's introduced me to others. And that is not true. And not only, I knew it wasn't true before I met Chloe. Because although I'm not a doctor, not a scientist, and I'm not talking to you as one, I'm speaking to you as a citizen, as a mom, as just someone who wants good for other people, right? Regardless of who they are, what their background is, I want to see people doing well. And it doesn't necessarily mean we're going to always agree on things, but I find this to be so insidious in what's happening. But so I'm talking to you from that perspective. And as a person who's not a doctor, I know that hormones are in the development of absolutely every single aspect of my life. Hormones are there. And so the notion of stopping it, blocking it with hormone blockers, I'm thinking, well, how will my child's brain continue to develop? So if you block their hormones that is necessary for their brain development, for their lung capacity, for their muscle strength and build,
mm-hmm.
then if you stop it, what happens during that period of time that they've stopped? You don't get those months or years back. So now my baby, even if we get off the hormone blockers, get on something else, they've missed an element of time that they can't go back to get. And so whereas most adults recognize that brain development, you may correct me on this, like a child, I tell my kids today, of course you would do that. Your brain's not fully developed yet. And we laugh. It was like, of course you would do that. Of course you would think that's the right way to go because your brain hasn't fully developed. So listen to me, my brain is developed, right? But now that even takes it beyond, 21, 25, when the brain is fully developed?
25, 26, 27, when your prefrontal cortex has fully come online. Absolutely.
Right. So now when you block their brain from developing at, 4, 5, 12, 15, 16, now instead of their frontal cortex being fully developed by 25, 26, 27, now maybe we're looking at 30, 35, 36.
And what's even more frightening is the answer is we don't even know. Those long-term studies don't exist. And if someone thinks they do, please call me because I think that's what's so scary. We do know there are side effects. Absolutely. And because these have been used in other medical treatments. However, not in this way, not for this period of time, and certainly not. Think about just psychologically when a child is blocked while all of their peers go on and go through puberty and go through those awkward stages and go through those hormone shifts. And sometimes it's miserable. But if you convince a child before puberty that's going to be traumatic and it's going to be scary and it's going to be the worst thing they've ever experienced, a child believes the trusted adults in their world. Of course, they're saying, oh, well, if I can pause it, why would I not do that? Then you do that. Well, you can't just not go through puberty. You're going to have to pick something. And what we do see then is, well, that's when they start the cross-sex hormones because they're so far apart now from peers that they were already probably feeling different than apart from or isolated from. And now think about how isolated this child is. Height-wise, they're not there. Different hair growth, muscle growth, bone density is something we know is impacted. Cognition, we just don't know to what effect. And that is where I feel like, it is, again, I think it's criminal to tell parents that this is just like you push the pause button like you would on your favorite song, and then you just hit play again, and it's like nothing's happened.
And this is what this particular book that is now going to be used to train future doctors and inform judges and lawyers. This is what this book is espousing.
It says that they are fully reversible. I don't know how you can make that statement. We know they're not. And then to think that somehow you can tell a child that developmentally, if you tell a 12-year-old, they're like, well, okay, I got it. It'll go back. I can press the pause button. You're putting it into language that A is incorrect, but B is, of course it would, I think, convince them to quote unquote consent to something that they don't have a clue what they're getting into. And how could they? They're children. And I think that's one of the things with whether it's a physician or a teacher or a parent. Sometimes it's our job just to hold on to reality for our child when reality is, it doesn't feel very good, or it doesn't, it's, I know this isn't easy, but I can't promise you that something is just magically going to happen, or is something that I know isn't real will happen. Again, you're setting them up for failure. You're setting them up for feeling worse about themselves down the road.
Hey, everyone. Just want to interrupt the podcast for a moment to tell you about a special offer. Mike Lindell has done it again. As usual, he's out there in the world finding solutions to problems we all have. My towels solved a problem that we all had with towels. You go into the store, they look so pretty, they look so soft, they feel soft, they look lotiony, and then you get them home and they don't actually dry your body. Well, that's why Mike Lindell made my towels. They actually work. They're soft and they absorb. And now My Pillow is excited to announce 2 brand new lines of my towels. Now, what makes them the best towels ever is that they're now made with a 100% long staple Sherpa cotton. This is a comb ring spun cotton that makes my towels even softer and more absorbent than ever. And now you get a 6-piece set for an amazing introductory price of $29.98. Now, you know that's not happening. I'm sure you're out there trying to purchase new towels now. You have friends and family coming over for the holidays, and you know that you're not going to get a 6-piece towel set of this quality for $29.98, but you can go to mypillow.com, use promo code Kathy with a K, or call 800-988-3934. That's 800-988-3934 and get your 6-piece introductory set for $29.98. You can get a designer premium line for just $20 more. Either way, you save $50. Everyone actually gets dried off and you look like a champ. So they actually work. Just go to mypillow.com and use promo code Kathy with a K. This offer won't last long, so please go order now. Being with Chloe and talking to some of the others who are detransitioners, who are now detransitioners, they are protective of their parents. And I can appreciate that. And so I never, push or anything like that. I understand the complexities of all of that. And yet, as a parent, if my child came and said, Mom, I think I was born in the wrong body, I would be like, go upstairs and go to bed. What are you talking about?
Yeah. Oh, well, and
like, I would never, now I would take it very serious. But I would go to social media. What are you looking at? I would go to the school. What are you teaching my baby? What's going on around here? I would look at putting them in an environment where they can just be a kid and not have to think about solving world problems like climate change, or else, solve climate change by age 9, or else you're not sufficient. And no matter, even if you told me that I needed my babies to affirm their confusion, I absolutely would not. I absolutely would never under no conditions would I ever, and generally I never say ever or never, but in this, I feel extremely convinced that I would never allow this to happen to my children.
Yeah. And I do feel that I think majority of parents do feel that same way that and I think part of it is they would do anything and everything to protect their child. They would do anything and everything to help them feel better as a child, as a human being, as all of those things. And I look at this so many times, I see parents saying, but that's what they told us we had to do or they were going to kill themselves. We had to do this or there was no other choice. And the distress was real. This child was saying, I feel so badly, or I need this so badly. And the doctors are agreeing with it. And the parents are feeling like, okay, fine, whatever will help. And you're the expert. You're saying this is the right thing to do. And that's where I feel like the medical and mental health community, we talked about this first hour, has completely failed these children.
As well as their parents, because I cannot imagine, the guilt that a parent must feel. And that wouldn't go away, because again, I don't think most people are evil people.
No, and the outcome, unfortunately, with their child is permanent. If you've right. If you've gone through surgeries, there are things that you can't go back from. And a lot of the hormone treatments you can't go back from. And so there's going to be a lot, I think, of challenges ahead of us. But again, I'm not going to give up hope. This is about kids. Obviously, as like you said, a mama bear, I'm going to protect my own kids, but I will talk about this to protect every child and every child's future.
Absolutely. Absolutely. I just, it is so sad to me. It is just criminal. It is evil. It is insidious. I mean, think of something when I just see children, my heart just goes out to them. You want good for them. And why is there such a rush to transition? Why not, if you want the model of transitioning, within 6 months, Chloe said she was on puberty blockers. Her friend said within 6 months, she was 18 when she first presented with some kind of dysphoria for the very first time, never presented it before 18. And within 6 months, her breasts were removed. Why is there such a rush towards the transitioning then?
Yeah. And that I don't have an answer for that. I don't understand when you take a child, and these are healthy children. These are children and healthy tissues, healthy body parts, and you are going to remove them and sentence them to a life of possibly more surgical complications, pain. You're sentencing them to not have the choice whether or not they want to breastfeed their child. If they choose to have children, now they may not be able to. They may have already had a hysterectomy and they don't. There's so many. And then to hear, I think some of the surgeons talk about, well, if you want them later, you can just put them back. Well, we think we know a little bit more about.
Is that possible? Can you put a uterus back?
That's where it just is. It blows my mind. And this was talking about a top surgery. And again, they talk about it like, oh, this is just an easy surgery. It's a radical.
Chloe can't get implants. The way they mutilated her, she can't get that. In fact, it still hasn't healed. And she had this surgery at the age of 15. It's 4 years later, and she's still dealing with leakage from the area. It won't heal. She has talked about, so I'm saying what she has said already, that I don't know what the technical word is, but at the age of 19, she's experiencing vaginal
tissue atrophy, because you no longer have the estrogen and the progesterone and all of those hormones that play a huge part in growth and development of all of your reproductive organs.
She's 19.
Mm-hmm. And there's tearing. They don't talk about all of the tearing that can occur. Very painful.
She's 19. She's 19, and she talks about having the I know this is sensitive, but the vagina of an 80-year-old woman. How do you right that wrong? Under what scenario is it okay to inflict that kind of, even if it's a possibility, even if it's a possibility, why would someone think, why would the science community, the medical community think this is a risk we're willing to take so that your outside can resemble what you feel on the inside? It never does. Because if you're a girl, if you're born with 2 X chromosomes, even if they remove your uterus and your breast, you're still a girl.
Yes. And that's, I talk all the time with folks about our chromosomes don't change. They were determined at conception. That doesn't ever change. And just because you take a hormone that you decide cross matches, it doesn't mean all of your chromosomes change, and all of the cells in your body have that XX or XY. That's it.
Do any of them change? Like, are they able to change even one or 2 of them?
No.
So I don't understand.
But what they come back with is, well, we're not telling kids that we can change their chromosomes. Well, but I'm sorry, to a 12-year-old, they don't understand that. Even if they're very well spoken and they can say, well, no, I understand that, but I still want to do this. They're not developmentally able to understand that you're not actually changing them completely.
From what I'm watching, since experience is everything, let me share some of my experience with parents. If you have a child and your child presents as older than their age, precocious, a command on a higher degree of vocabulary than their peers, protect your child. We should all protect our children regardless of where they fall, but specifically in the culture in which we're living in. What I am experiencing as I'm walking around across the nation, talking to a lot of people, if your child presents as very mature for their age, protect them.
Absolutely. And I think the other piece to that, as much as we're hearing American Academy of Pediatrics and the Endocrine Society and now American Psychiatric Association say you affirm often and you affirm early, and that's the way you do it. Parents, talk to your kids often and early about who they are, about who they always have been. That's where I think we can protect them, because they can take that with them anywhere they go. That bubble will go with them. And you, just like we talked about before, you are the expert in your child.
That is so profound. I could talk to you forever. Dr. Schwartz, thank you so much for your time. If I may have just 5 more minutes of your time, let me ask you just vocabulary. Okay. I'm all about vocabulary. Who was it? Joseph Stalin, who said, "He who controls language rules the world." And whether you're talking about Black Lives Matter, Antifa, affirming, gender-affirming care, any of these particular groups that seem to have popped up like mushrooms all around us in the last 10 years, they are experts on creating whole new vocabularies, right? Like, for example, I am no longer a heterosexual. I am now cisgender, which I refuse to acknowledge or say. I'm a heterosexual. I like men. I'm a woman. I like men. What's a cisgender?
I honestly am not. I think what I'm going to do is not touch that one, only because I think it changes so rapidly. And the other thing is in my professional association's new book, it is a form of discrimination.
Wow. So now a doctor can't, and I agree. I hear Jordan Peterson talking about this all the time, right? That you can get in a lot of trouble by saying it. So let me say it as a layman. What about dysphoria? What is dysphoria?
Dysphoria is it's a strong sense of distress about anything. So you can have dysphoria pretty much about anything. So it's not when you have gender dysphoria, it's dysphoria or a strong, intense challenge with gender related issues. Does that make sense?
It does.
Yeah.
Now, do we treat any of the other dysphorias with as much affirmation as we do gender dysphoria?
I mean, think about, we can use so many different examples. Eating disorders is a really good example.
So an eating disorder is a dysphoria because they're displaying great distress.
Distress about how they see themselves. Someone comes in and is dangerously underweight and is saying, I'm distressed because I feel like I still appear overweight, or I appear fat, or I don't like the way I look.
Do you affirm them?
Of course not.
Do you validate them?
I validate their feelings around what's going on, but then we extend out to, where is it coming from? Why do you feel this way? Is this connected to, and again, 10,000 different things. Is this trying to control eating because you don't have control over your life, because there's sexual trauma that has left you feeling out of control. And so this is an area of your life that you can control. And this is one small example of all kinds of reasons people can develop eating disorders. So there's so many different feelings. There's so many distorted thoughts about oneself that people have for many different reasons, that we work with and we challenge and we grow their ability to understand where it's coming from and whether or not that's actually their reality. But if no one's challenging it, then they're just being told, you're right. You were born in the wrong body. You were wrong. You were created wrong.
So I'm watching someone who's dangerously underweight. And if I apply the same logic that is being applied to dysphoria around gender, I would look at this dangerously underweight person and say, you're right, you're fat. Continue to not eat.
Well, and then would you give them medicine? Yeah, medicine to lose more weight. Would you do surgeries to take off more parts to more closely?
Right. And I don't think any, again, logical person would say I would treat someone who is obsessing over their weight, and I would not affirm that if it wasn't appropriate. But I cannot say logical people would say the same thing with little children who are having great anxiety or distress about their gender.
Yeah, and they're going to look to a textbook on how to deal with it.
Yeah, like they just wrote a textbook saying, don't go against logic and do the opposite. I am not a scientist. I am not a doctor. I do not play one on TV. I am not trying to pretend that I'm smarter than I am on these topics. And yet I understand what is happening. And yet I understand. And I think most people do. We just have to become comfortable with not knowing everything, become comfortable and speaking what we do believe, whether it's right or wrong. But you're right. You said something so critical earlier. We live in a culture where there is no room for a mistake. You have to be perfect all the time. If you said something 10 years on social media, by golly, that's exactly who you are today. And they do not allow for growth. Mm-hmm. You are whatever you say, and I don't care if it was 10 years ago. And that's a lot of pressure. And I think it's very unique individuals who learn very rapidly. I tell my children, we don't wake up saying, I can't wait to be rejected today. But we wake up recognizing we're not going to be everyone's cup of tea. Everyone's not going to like everything we have to say. And yet we have to be strong enough to protect our kindness. We have to be strong enough and be willing to stand up and speak truth, even when it's uncomfortable for people. Any last words of advice, Doctor?
I think, I probably just would double down on what I said before. Parents, be having conversations with your kids about who they are, about all the wonderful, unique parts of their identity now, and that it will grow in the future. And that's where I think there's hope for this. Parents and caregivers and the love they have for their children. You're the expert.
Dr. Lauren Schultz, thank you so much for spending time with me. I appreciate it.
Thank you so much for having me. Like I said, I could talk for hours too about this. So it was wonderful to be able to talk with you. I so enjoyed it.
Yes, blessings. Bye-bye.